I have been in healthcare for about 25 years. Almost every bit of those 25 years has been in the emergency department. I started in a trauma center in Ohio, moved over to Northern Virginia, worked in a couple of ERs over there, and then last 14 years have been with Shore Regional Health. I started out as a patient care technician in the emergency room, got my bachelor's of science in nursing and started as a nurse in the ERs. And one day I was an ER nurse caring for a patient who had been sexually assaulted. One of the forensic nurses came in and we started chatting, and I was like, this might be kind of a cool way, something else to do. And I ended up taking the class, really having no idea that this would become my passion in nursing. So SANE is an acronym that's used. There's a lot of acronyms in our line of work. SANE is Sexual Assault Nurse Examiner or Sexual Assault Nurse Examination. The profession as a whole has kind of moved towards the FNE, which is Forensic Nurse Examiner, because we do care for patients that have had physical abuse or physical assault, domestic violence. We're providing those exams for them as well, not just sexual assault survivors. So lots of acronyms, but forensic nurse examiners provide sexual assault nurse examinations. This past year, in 2024, we have had our busiest. I know it's unfortunate that we have had to have all of these, that sexual assault is still happening. However, it's going to happen whether we are doing the exams or not. So I'm very excited that we have provided services to, we've responded over 70 times this year. I will say that pediatric exams sometimes can get more complicated in the fact that anyone under 13, well, actually, depending on the circumstances, anyone under 18, there's mandated reporting and things like that that need to happen with anyone that's involved in emergency medicine. So a child comes in and possibly their parents say that there's a concern for this, or that the child says it themselves, makes a disclosure in the emergency room. There is a protocol set up to where law enforcement, Department of Social Services are involved. They come and assess the case there, and then they would call the forensic nurse in if there's any need for, if it's an acute injury or acute case and evidence needs to be collected. So probably the easiest way to explain this is to take a person that is 13 years to 18, if we want to do the pediatric case. Anyone above 13 in the state of Maryland is able to consent or decline any portion of the sexual assault exam. So if they show up into the ER and they say that they have been assaulted, the ER staff would call one of our nurses in, and we respond. And basically, we come in, we care for that patient one-on-one. It is as an ER nurse for 30 years, it's an amazing thing to have a nurse that's coming in and caring solely for that patient and providing that patient all the time in the world to complete this exam. When we get there, it's a pretty systematic approach to how we care for the patients. We initially will sit down, we'll get to know them, but we make sure that they know their rights as a crime victim and their options in the ER that day for us, or with our team. If they choose to move forward with the exam, then we kind of start our process to where we sit with them and we work very hard to only have them tell that story of what happened one time. It's really important to us that they only have to go through those details one time. I've been told by many patients that I've cared for over the years that that could be the hardest part of that exam. So we get their story, and that story from that point on guides our exam. So once we get that story, we start a head-to-toe examination. Again, very systematically, start at the head, start on one side. We are looking for any injury that might have happened. We can document, on a body map writing down with words what we see, we also offer photography documentation. So we can take a picture of anything that we see. We can look for bruises, abrasions, lacerations, and to be quite honest, we document anything we see. Even if someone says, my dog scratched this part of my arm, we're still going to document that that scratch is there. We document anything that we see, just providing a greater picture. And with that, if we would see a bite mark on the arm, we will assess for and collect any evidence that might need to be collected. What that entails is taking a large cotton swab and rubbing it over the area and attempting to pick up any DNA from the suspect. We document, the patient's demeanor. If there's a place in our documentation where we talk about if the patient became tearful. There is no right one way that someone responds to trauma. I've had patients that laugh uncontrollably because they don't know what else to do. And while those that aren't trained in trauma might think that that is completely inappropriate, but there is never a right or wrong response to how you are dealing with the trauma that you just went through. But then we do have a long conversation with these patients about community resources, referrals. We also work, I can't stress the importance of the work that we do with For All Seasons. They have 24-hour, 365-day coverage just like us. They meet the patient in the ER with patient advocates from their Rape Crisis Center. And from then on out, that is that person's right hand to dealing with the kind of the process that can last many months, if not a year plus after the actual assault. It has also been proven, scientific studies have shown that survivors of sexual assault that are treated by forensic nurses have more positive outcomes. They follow through with the investigation process. They follow through with the prosecution process more highly than survivors that are not, or either don't make it to a hospital to get that treatment or aren't in a place where they can access forensic nurses. In Maryland, I think it is very exciting, the progress that we are making in, one, making forensic nurse exams accessible. Two, the legislative side of things. Maryland has an amazing kind of group, and Maryland Coalition Against Sexual Assaults works tirelessly on the legislative portion of funding, access, all the things that go into stopping and ultimately ending sexual assault.
You think Maryland's unique in that sense?
I do. Maryland offers, it's great for the community to know this, Maryland offers, we can collect a sexual assault kit, the evidence kit, and go through that exam anonymously without talking to police at the day that you come to the hospital. You do not have to talk to police that day if you do not want to. We can do the entire exam. And what happens is a number is put on the outside of that evidence kit. There is no identifying information that is passed on to police. It is stored in a law enforcement location, but they have no idea the name that's on the inside of that envelope. And that evidence actually can be held for 75 years. And that is, I don't know, ranking in the states across the country, but that it is, I know our neighboring states do not have that option where Maryland does. We hope that, and I will respond at the same time again and again and again in hopes that that is the day that the cycle of violence, that I'm able to kind of crack through that cycle of violence. There is a million reasons why someone goes back, and like I said, I am not there to judge any of those reasons. I'm there to provide the resources and hook those people up with community services that can help them get out of that situation. So in the state of Maryland, the Maryland Board of Nursing kind of is our governing body that helps with our credentialing and things as of right now. You have to be a nurse for 18 months in the state of Maryland. prior to going to the class and starting the process. There's then a 40-hour didactic class, and there's multiple places. We unfortunately at Shore Regional Health are not currently teaching that class, hopefully in the future, but right now we are not, but there are many classes throughout, live virtual classes, hybrid classes where you do some online work and you show up in person. Lots of different options there. Once you complete that 40-hour didactic or classroom portion, then there's about 40-ish hours of clinical portion. At Shore Regional Health, if you live in the area and you've completed the classroom, you can then get a hold of me and we can help you complete those clinical portions. Once you've done the classroom and the clinical, you can apply for your F&E license through the Board of Nursing. And you do the adult adolescent portion of the exam, or of the license first, and then you can repeat that process for the pediatric portion if so interested down the line.